Avulsion fractures are often termed apophysitis. Just a reminder, growth injuries frequently occur during the period of rapid growth spurts in adolescence. When you have an apophyseal growth plate, you have a tractional growth plate. An epiphyseal growth plate is going to be a compression growth plate. So these avulsion fractures are generally occurring at that tractional growth plate. They can also occur in the skeletally mature, such as football punters or field goal kickers. You have several sites that are common to apophysitis at the hip. You will see the iliac crest where the internal and external obliques and gluteus maximus attach, the ASIS where the sartorius originates, the AIIS, which is the attachment of the rectus femoris, the ischial tuberosity where the hamstrings attach. When this occurs, we will term this the hurdler's fracture. The greater trochanter where the gluteus medius attaches, the lesser trochanter, which is the attachment of the iliopsoas, and the pubis where your different adductor muscles attach. The mechanism of injury is generally an acute eccentric overload. Signs and symptoms include things such as a painful gait or localized bony point tenderness, which is oftentimes key to the clinical diagnosis. If it's a superficial, it may be localized edema with a slight bulge and a palpable defect, but if it's deeper, there won't really be anything to see. I have seen multiple avulsion fractures, and pretty much all of the people that have had them have hit the ground after it has happened. I've seen a soccer player who jumped up to head the ball and avulsed his ASIS. There was a softball player who did it simply running around first base. She was complaining prior to participating that she was having some hip issues, so that was probably something that was more of a chronic situation. I saw a baseball player, similar thing, rounding at second base and just hit the ground. And all three of these people hit the ground. And then an interesting case was an individual who simply was trying to get out of a desk and moved his leg to the left, and when he stood up, he popped. He is the only person that did not hit the ground, just had a lot of pain. Range of motion, you will find a decreased hip, active and passive range of motion that's specific to the involved muscle. Diagnosis-wise will be through an x-ray, a bone scan, or an MRI. Treatment is going to be conservative, especially if the person is skeletally immature. They still have ample healing capabilities, and so treating it conservatively is important. And all of these individuals were put on crutches, and it was treated as a fracture. And so after 6 weeks, it had healed at that time.